We are live on YouTube as well. Let me just double check. Live on YouTube as well. Okay. I'll begin the session in next 2 minutes. Just waiting for a few more students to join, maybe. Good morning, everyone, and good evening as well. Welcome back. It's a happy Sunday, I know today for some of you, and I think it's a Sunday evening in some of the countries as well. So good evening to those students, and thanks for taking time to come online today. I know in Sunday sometime it's hard for some students, right? Now, let me see here. I'm just gonna start the screen sharing at the same time. And hopefully more students are connecting soon. Okay, so before I begin with anything, just want to double check if my voice is audible enough, and you can also see my screen, everyone. Just need to make sure everyone can hear me. Everyone can see the screen. Perfect. Okay, let's get started now. So in today's class, I think first of all, this is the one of the most, I think, waiting lecture by lots of students, because many students, they were like, ma'am, bring something on case studies. So this is the first session I'm bringing out today on the case study strategies. But I'm also planning, just so you know, to do some more on case studies as well, because definitely reading the case study sometime takes long time as well. So I'll try to bring some more questions in the future. So just keep checking my all the updates further on the WhatsApp if you are with me on the WhatsApp, or maybe on the YouTube if you're with me on the YouTube, right? So in this class, what I'm going to talk about is, I'm actually going to talk about, first of all, why do we need to study the case studies? This is very important because if we do not know why they are very important for the NCLEX exam, then sometimes they do not build really too much, interest when you're reading them. They sound so boring sometimes to some students. So I think knowing first thing why they are very important is a great idea before we start with any of the questions for practice today. I highly, highly recommend everyone just mute your mic, please. Some students' mics are unmute, so just mute yourself, and you can definitely unmute when you have any questions for me, or you want to participate together with me in some questions too. Okay, I'm just gonna make a mute for everyone as well from my end. Let me see here. One person is on mute right now. Okay, everyone is mute now. Perfect. So the first thing is why they are very important to study for the NCLEX examination, right? So the first thing is I have seen the case studies basically help you to think as a real nurse. Real nurse means you pretend yourself as an RN if you're writing exam for the RN, or if you're writing exam for PN, LPN, then definitely you think as a real nurse in that case. And they're very interesting. Why? Because in this one, they actually help you to understand when the nurse need to go for some assessments, when you need to go for some planning, some interventions, just like a real clinical settings, you're working somewhere. So you will see all those questions with me today in the next upcoming slide, but this is how you feel in there. And that's why I feel like they're very important, because they're making you prepare enough for to work as a nurse on the floor after passing your NCLEX examination. The second thing I have noticed, they build actually your clinical judgment skills really, really strong enough. What does it mean? So basically, we do have a model which is by the NSCBN. We call that the clinical judgment measurement model. And that model we actually use in here in every single question, how to basically notice the cue into every question, how to make a final decision, making decision for your client, evaluating the outcomes. So all those things basically help you a lot at the end of the day, build your clinical judgment skills really, really strong enough that you feel more confident, after passing the NCLEX, how to apply on the floor, because your purpose should not only supposed to be just passing the NCLEX, your purpose supposed to be how to apply everything on the floor once you go into the clinical settings, right? And third thing I noticed that why they're very important, because they cover multiple topics in one scenario. It's not just like if one scenario is related to maternity, then they only talks about maternity. No. NCLEX these days, they love to ask you multiple different system in one single scenario. So I feel like it's like 360-degree connected everything. And it really helps you to understand, why then reading every system is important, as I always focus in my previous classes too. Like, please read the Sounders book if you have enough time to read the content, right? So, or if you're reading content from a different resource, that's okay as well. But as long as you know those topics and how to apply them in one single client, in one single patient as well. So this is something you see in the case studies as well. The last thing what I noticed as well, like it actually improve your overall score in the real examination. You might heard before some students says online, I got a more case studies and then I passed the NCLEX. Some students like, I got a less case studies, I failed the NCLEX. And I got like few case studies, I still passed the NCLEX. Overall, what I feel like is in every single examination, if I'm talking about according to these days, like something currently, presently, when I'm recording this video, I have seen majority of the students, they're getting minimum somewhere 3 case studies for sure. And the 6 usually max what they get. And I personally feel they actually help you to boost the score because they do have the partial credit system in there. What does it mean? Even some questions answer are wrong in there, they still give you some score for the right answers. So which is good, right? So I personally feel this is actually overall improving your score for sure. And the other thing I noticed that it also help you to train for the time management skills also, not just during the test, but also, as I said, when you go and work in the clinical setting as a nurses, right? You really need to know like how to do the prioritization. What are you going to do first? What is the best action you can do at that time? Or what nursing interventions you're going to do in your whole shift for that particular patient, right? It basically helps you a lot to manage your skills on the floor as well. So I really love case studies. This is what I feel like it. So try your best to use the strategies today, the one I'm going to show it to you. Because in today's lecture, what I'm bringing is I'm actually bringing some strategies which actually helps you for the NCLEX. I'm only talking about the NCLEX. So for the NCLEX examination, excuse me, what I feel like some strategies are those in case studies. Even if you do not read the case study, you can still find out the right answer. This is what I notice, right? And some case studies I notice you need a little bit knowledge, but not too much. But some case studies that definitely require your knowledge from the books, right? So it's still a good idea to read a basic topic sometimes before you apply anything into the case studies as well. But anyways, in today's lecture, we're going to talk about all different strategies and how to apply into the questions as well. And that's what we're going to do in here today. So before I see any question further, the very quick guideline for all of you, like what kind of case studies are questioned in the NCLEX, basically they ask. Overall, what I feel like about it is the first kind of case study question, the one everybody is getting, it's a full case study question. Full case study means like in that case study, they're going to give you like more about the patient scenario related to nursing notes, vital signs, lab results, some progress notes. It could be physician order, or even it could be diagnostic tests as well. Like it could be any information about your client. And this is very common format in the NGN, what you're going to see when you also writing your NCLEX examination as well. Now, I have noticed in this first kind of case study question, majority of the time, 6 questions linked to each case study. But as I said, sometimes, but it's very rare. Sometimes it could be anywhere between 1 to 6, but it's very rare cases. But majority of the time, students, they get 6 questions with each case study. And I'm mentioning back again, how many case studies you will get in the exam? Between 3 to 6, right? As I said, this is the average number as of today, what most of the students are getting in the NCLEX, right? Now, in those type of questions, what I noticed that they actually want to check these few 6 things in there for you. The first thing they really want to see if you really know as a nurse how to identify the relevant information from the case study. Something important, something not important, right? What do you think it's an emergency? What do you think it's a non-emergency? Something, if you really have idea how to read it and how to pick that information quickly. The second thing I noticed that eliminate the irrelevant information, which means sometimes we focus on such an information which we do not need it at all to find out the right answer for the question. So the NCLEX is really checking if you really know how to, like find out the relevant information, what you exactly need to know, and something irrelevant which you can skim and scan and you can just skip it because you don't need that at that time to solve the solution to the problem, right? The another thing I noticed that in those type of questions, you also need to know how to prioritize in there. Prioritize could be maybe a symptom if they give you multiple symptoms together. Like, do you really know out of all those symptom list, what symptoms comes first or most important for you? Or if they give you multiple conditions at the same time in one patient, or maybe in a one case study, if they give you 5, 6 different patients together, and this can also be possible as well. Everyone remember that because NGN is always keep changing sometimes, every month or 2 months. So sometimes we see in the recent trend also in one case study, multiple patients could be there too. And if you got a multiple conditions together, do you really know which patient you want to assess first and why? This is something the case studies figure out from you. Another thing I noticed that if you really know how to identify the expected outcomes as well, expected outcome means like what the outcome look like. Maybe it's a 2 different outcomes you think, but at the end of the day, are those really expected or not? What the question actually asking from you, right? So this is what we're going to see again in the case studies today. And also in moving on future, as I said, I'm going to bring more maybe lectures on this one too, because this is one of the vast subject. And I think everybody needs to practice more on this. Now, choose the appropriate nursing intervention. Appropriate nursing intervention means they might gonna give you different nursing interventions together, but maybe all of them are relevant. But as per the question, what comes first, right? As we always practice earlier in this standalone question. And sometimes they also checking if you really know how to evaluate the trends right now in the present condition, which means they might gonna give you present past history as well, past medical history, surgical history, then present symptom maybe from tomorrow morning, and then again present symptom this morning, and again present symptom maybe 2 hours ago or 1 hour ago. So they're really checking if you really know how to compare them and how to find out the trends in there in that patient condition, and then what could be the final outcome basically in there. So as an example, this is just a small example in short, like if a patient admitted with a CHF, congested heart failure, do you really know how to identify the abnormal problems in there or how to prioritize the intervention in that time or how to monitor a response to the treatment? So it could be anything in the case studies, what we're going to see it together. Now, the next thing I noticed that in the case studies, it's not just the multiple questions in one case study. Sometimes remember everyone, there could be one case study in front of you and only one single question related to that, right? And majority of the time, those case studies are very, I would say, lengthy enough to read it. The one I know, most of the time the students feel like, oh my God, it's too much information to read in there just to find out the one single answer. So yes, that could be also be possible, right? Those ones I usually call them standalone NGN type of questions, right? These are the most common example, the question, what they're gonna be there. And we also gonna practice them today in the moving on slides, so don't worry about it. But what I would say regarding this one, they're basically testing it without even reading the case study. Do you really have a quick judgment with you as a nurse? Like how to find out the answer without even you know the full information about the client, right? This is what the NCLEX is about at the same time. So for example, choosing the correct nursing action. If I give you 4 nursing action for a patient with a sepsis, right? If you really know out of 4 what comes most important or the first nursing action, what are you going to do with that patient, right? So this is just the common example. Now this is just a theory part, just so you all know what I talk about so far about the case studies, right? Now is the actual practice in front of you. And definitely, I highly recommend everyone, please write down some notes while I'm doing all these questions with you together. And also try to participate with me if you can. Okay. So the very first type of question, what I bring in here is, I usually call this one immediate follow-up type of question in the case study. Why did I highlight it that? Because I personally feel majority of the case studies, they have their own NCLEX strategy behind the scenes, how to basically solve the question and how to find out the answer. So the first strategy I'm going to discuss here, the one which is related to immediate, something word with the immediate follow-up or immediate something you want to do as a nurse in there in that particular case study or case scenario, right? Now, before I read into the question, before I say anything how to do this type of question, I want to give you a quick idea for those students who never see the case studies before for the NCLEX and you're very new in this NCLEX journey. So just so you know, when you're getting the case study questions in the real exam, on the left side of the screen, the one I'm highlighting right now, left side of the screen, you will see the case scenario always, okay? And the right side of the screen, you will always see the question next to that every time. Doesn't matter, it's the same question related to same case study or one case study has a 6 question. Every time you will see the case study on the left side of the screen. This is the one we have pattern so far until today. There is nothing changes so far yet. Okay. Now back to how to solve this type of question when it comes with the word immediate, right? I personally feel everyone, when the question comes with an immediate word, remember everyone, I don't think so. You need to read the case study. You can do this question without even reading the case study, right? So this is how I want to highlight it, the very first thing. So my first few slides, like 3 or 4 questions, I bring actually those ones. No knowledge, without reading case study, how you can pull up the answer, because this is the always most common question by a lot of nurses, like is there any tips or tricks to find out the answer quickly? So yes, so this is the first type of question when the word comes with the immediate. I don't think so you have to read even the case study as well, right? But if you need to, I'll show you later how to read the case study as well, okay? But the first step, I want to show you how to do this question without even reading the case study, okay? Because as I see here, the question says, which of the following client finding require immediate follow-up? Now, when the word comes, immediate, I personally feel like something concern, something life-threatening, maybe right now, or it could be if I don't go there, right? This is, I always think, those 2, 3 terms in my brain. And then I see the question, it says select all that apply, right? Now that means you only pick up that answer which you know. Something you don't know, better not to play. I always says that. For the select all that apply, the marking criteria will be still same, right? And yes, you can get select all that apply in case studies as well. So it's the same method, good idea, bad idea, if it's a long sentence. If you already watched my previous videos on select all that apply, what I'm talking about. But if it's just a symptom, I'll show you immediate how to do it, right? So when I see here the blood pressure, the first one, I see the blood pressure on the screen quickly. Just give and scan. It says 88 by 58, right? So you ask yourself, everyone, now if you want to unmute your mic, you want to participate with me. Tell me,
This
guys.
is mandatory.
Yes, Sammy?
Yes, this is mandatory, ma'am.
Very good. So if any patient, doesn't matter for me, right? Who is the patient in front of me? If anyone has a blood pressure 88 by 58, I would be very concerned about it, right? And definitely I'll go and jump into and do the follow-up about this one. So this is a good idea to keep it in. So I'll keep this option in as well. But everyone, please participate together, because if you're not going to participate, believe me, you're just going to learn a little bit out of it from this presentation. But the more you ask me questions, the more you participate, the more you will understand, as you know me. Now, the second one I see here, the vowel sounds, right? Well, if you want to read about the vowel sounds here, you can, but I would just ask myself, I just noticed here, okay, hypoactive, right? But I would just ask myself, like, vowel sounds, even if it's like, hypoactive or hyperactive, whatever. Do you think the vowel sounds are like emergency? Something you want to go
Not
down?
mandatory.
No,
No,
ma'am.
No, ma'am.
not a mandatory to go right
Not
away. That
mandatory.
can wait, right? So vowel sounds, I'm not going to keep it in. See, without reading case study, this is how you can think logically. But if you still want to relate with the hypoactive, you can. Heart rate is like 120.
Yes, ma'am. This is
Anything
mandatory.
concerned? Very good. Mandatory. Let's hold on.
Pulse
Breathing
is
so
mandate.
far. Very good. Mental status, right? Now, mental status, even if you think in generally, do you think for any patient, mental status is important to check, or is it not important to check?
Yes,
Ma'am,
ma'am.
this is important to
Important
check.
to
It's very
check.
Yes,
important.
But
ma'am.
if you, yeah, but even
Yeah.
if you still want to go to case study here later on with me, we can go together. But the first thing rule, I'm showing you how to do the answer without case study. But I'll show you later still how to read case study, how to, match your answer still. Now, pupil assessment, right? Pupil assessment is such a thing. You cannot just think, just like that. You have to maybe look into the case study a little bit. Where's the pupil assessment? Now, if I see and skim and scan, I'm like, okay, pupils here are equally like at 5 mm. Usually it's between 2 to 4 when someone is basically to the direct light. Now, here I can see it's a 5 mm. So it's not that big, but it's only a little bit. I can see abnormal still, but it reacts still sluggishly to the light. Now, do you
Sluggish,
think this
ma'am.
is
This is,
emergency that cannot wait? You want to keep it in or you want to take it out?
ma'am,
No, ma'am.
personally, if I say I would like to keep it in because
Mm-hmm.
this is already sluggish, and
Mm-hmm.
furthermore, we need to know maybe he could go into the such as in like
Uh-huh.
increase ICP and furthermore thing.
Uh-huh. So one thing I
But
want
this
to
is
ask in
not
here now, Sammy. So when you say you want to keep it in, do you think it's an emergency for you?
no, this is not in emergency.
There you go. So the word we are looking here is immediate, right?
Yeah,
I
got
hope
the
I
point.
hope it's making sense, right? Maybe
Yeah,
everything
yeah,
is
yeah, yeah.
important here to study, but the question, they always say like immediate. You remember I just show you like in a previous slide, like do you really know how to eliminate the irrelevant information, what they're not asking? How to find out the relevant information cues from the question itself. So this is I want to highlight it in here too. Maybe it's important still because you know that okay, this is might gonna happen if I don't go there, but the question says immediately. So always ask yourself, everyone, images is like an emergency. Oh, something concerned, something life threatening. Is the patient gonna die if I don't look at this? Right? So this is the way you look after this question. So 5, I would not keep it in. That can wait as of now, right? Now ask yourself, everyone, suprapubic fullness. Is that something bad, good, concerning, not concerning?
Ma'am, this is not concerning.
What does the suprapubic fullness indicate? Anyone? What is the
Ma'am,
meaning of
no,
that?
I don't know.
Okay, something, if somebody don't know in here, sorry, better not to click the answer because it select all the reply. But some students who know, they can think according to that. But for the knowledge part, just so you all know, suprapubic fullness is just nothing. It's just that like above your pubic area, it's full, which means indicate the bladder is basically full. So if there's a lot of urine retention is in there inside someone, do you think that is concerned or that is not concerned? Thinking about the vital signs.
Not concerned.
Anyone?
It's concern.
It's
Ma'am, this is
concern.
concern.
Very
Just
good.
because of that, the heart rate
Yeah.
and the mental status and
Very good.
the blood
Yeah.
pressure is
Very good.
directly
Even
is directly hit the
infection.
these vital signs.
Very good.
Because if a
Very good.
patient is in retention, so he would might be tachycardic, he would
Mm-hmm.
might be irritated, he would might be agitated. So
Mm-hmm.
he will definitely change the person, a GCS level and the other vital signs.
There you go,
Yes,
right?
ma'am.
So if
And
someone know this,
autonomic
as I said,
dyslexia.
then you only pick up this answer. So
Even
far my answer case 1, 3, 4, and 6, because I think, oh, that's an emergency, life-threatening could be if I don't go there. But now let's do this question without knowledge, with knowledge, everyone. Sorry,
even
with
they
knowledge and looking at the case study. Yes, someone has a question for me. I can see Manpreet has a question.
even they can get infection if they have prolonged urinary retention.
Very good, Manpreet. That's another right answer for sure as well, right? Now I want to show you guys what to do if you really want to read the case study, right? So those students who are like, I don't want to, take a chance in the exam. I still want to read the case study, ma'am. Let me just read the case study. So for those students, I want to show you a little bit shortcut how to read the case study, the exam. And to do that, I'm just going to go back into my slide little bit. And why did I do that now? Because I want to show you still how to do this question. How you can do this question in another different method way. So I hope everyone can see my slide still. But if it's not visible, please let me know at the same time, right? Now, if you notice that I actually take a back screen just to make the notes. Now, this is a highly recommend for the case study question, every single case study question in which you think you must need to read the case study. So everyone remember, in the real nursing NCLEX examination, you will also always get the whiteboard or rough paper with you. They always give you rough paper, pen, pencil, or maybe whiteboard with a marker. It depends where you're writing the test, in which country, in which testing center. Now, what is the purpose of that board? Use it. Use it, please. Now, how are you going to use it, right? I highly recommend it. Out of each case study which you're reading it, maximum 5 points, minimum 2 points. That's it, right? Now, what do I mean with the maximum 5 points, minimum 2 points with that? Because what I think is, when you tell your brain something like more into the form of conclusion, you actually remember the more in there, right? So what I'm going to do here is I'm just going to read it quickly in front of you, and I'm only going to pull up something out which I think something concern for me as a nurse, right? And only that thing I'm going to write it down here in the real paper as well, right? Now the screen might be a little bit short for you. I'll make it zoom for you as well at the same time so you can read the enough information with me, right? So I see that it's a 8 o'clock nursing note, something look like. The client brought to the merge by the parents after taking unknown number of tablets 3 hours ago. So this is, we don't know how many tabs was taken, but it's already 3 hours ago. Okay, well, if you think it's important for you to write it down, then write it down. But for me, I think I can remember it easily by the time I look into the question. So I don't need to write this information personally for myself. But if you think you want it, write down into very short language, not a complete sentence, because you don't have enough time in the real test, right? Now, the client was found with the empty prescription bottle on the floor nearby. Okay. It's the same thing, what they just talked about it. And then they said lethargic, mumbles, incoherently, arouses with the repeated physical stimulation. I would be like mental status, question mark. What's going on in here? Why the patient is more lethargic, mumbles, incoherently, rouses, whatever, they give you all those things. I would be like, why is it like that? Question mark to my brain, right? And then they said the face is flushed and the skin is hot and dry. Okay, if you think it's important for you, write it down. If you think it's not, then don't write it down. I would be like, for me, face flushed, question mark, right? And then it says pupils are equal and they are like at 5 mm, react sluggishly. I'm not very much concerned about it because I already read the question like immediate. Now, before I finding the answer, I'm like, I'm not really concerned because this can wait. And then it's like breath sounds are clear,
Ma'am,
so they are like normal. I'm not concerned about this again too. And S1, S2 heard, okay, that's normal again. I'm not concerned about it. Pulses are +2. Even if they give me +3 or +4, I'm not concerned about it because that can wait. And then it says the abdomen is the soft with the hypoactive. I'm not concerned about it again because why? In the question, we are only looking for immediate, right? And to my brain, it's only I'm going to write it down that thing which makes me concerned as a nurse, right? Suprapubic fullness. Why suprapubic fullness? So, in the exam, I will write down like a shortcut, like something like that, suprapubic fullness question mark in my brain, right? And then I write down like a fever question mark, tachy question mark, right? Respiration sounds okay to me. Blood pressure question mark, right? And then the oxygen is okay, seems to me. So did you guys notice, right? Even if you cannot maybe see my screen clearly right now, because I minimized a little bit right now, just to write down some notes and show it to you the idea how to make some notes in here. So far, I only make 1, 2, 3, 4, 5, 6. 6 max. But if you want to delete one out of it, you can if you want to. I usually try my best between 2 to 5 maximum. Now, what is the purpose of writing this one? By the time you reach to the question and you try to find out the real answer for this question, your brain actually already knows that like maximum 5, 6 things are concerned in here. And out of them, you have to match with your answer keys and think about it. Yes or no, good idea, bad idea. It's a select all the reply question, right? But always keep in the mind the word immediate at the same time, because when I say immediate, you don't want to write everything which is abnormal here. No, you only need to write down that thing which is something an emergency or could be an emergency, something which cannot wait at all, right? So this is how I read the case study personally. If I ended up in reading case study for any single question in the test, right? And then after I make 4 5 points like this, then I read the question again and match the answer, find out my final answer and revise the answer again, and then go to the next screen, right? So this is how everyone's supposed to do the case study. So now this is just the first example I show you with the immediate follow-up. I hope everyone learned something out of it. You can always use the chat box in the YouTube as well. I can see lots of students are in there as well today. So welcome everyone. Feel free to ask me any doubt, any question in the chat box too in the YouTube, or maybe if someone unmute the mic, if you do have question for me, you can always unmute or raise your hands as well, right? Now, moving on to the second question for today for the case study. This is what I call fill in the blanks type of question, right? Fill in the blanks type of question, majority of them, they actually give you in the form of word choices. Like there are some words choices at the bottom, and you have to put the answer in these blanks using all these choices what you have in front of you, right? Now, again, for the fill in the blanks, I personally think you can again do this question without reading case study most of the time. This is what I think personally, but I only jump to case study if I need it. Okay, so let's see this question together again with me, how I'm going to do without reading case study, because we are still working on without reading case study so far. So I see the actual question here is the nurse has reviewed the information from the nursing notes and the vital signs. Read the question very carefully. Every case study question has its own meaning. Now, when I say nursing notes, I only want to look at the nursing notes. When I say vital signs, I only want to look at the vital signs. Now, this case study, just so you know, I already put the continue here, which means this is related to your previous case study. So in the real paper, you will get on the one page 8 o'clock notes. You will also get the 8:15 notes. You will also get the 10 o'clock notes at the same time in a one single page. But today is just like a dummy, a presentation. I cannot fix everything in a one page. Otherwise, everybody cannot read it, right? So what I did here is when I see that nursing notes, vital signs, okay, they give me nursing notes, they give me vital signs. Now, when I see the actual question at the bottom, they said the need for further IV fluid administration. IV fluid administration. That means question is related to this one, actually, further required, and which is based upon the client dash, first blank, dash, and the dash. So three different blanks we have here together. So logically, ask yourself, everyone, right? When the question comes is basically on the IV fluids right now, right? Do you think for the IV fluids, like you're gonna look at everything and put every option in here? No, you're only gonna put three options in here. So I will ask my brain which three options are really good, and those three options are actually based upon those I'm going to decide to give the IV fluids today to my patient, right? So ask yourself. So first of all, I would pick the very easiest one for you, and then you can participate with me together. Urine output, right? Because whenever you see any urine output for any patient, that makes you decide, okay, if it's low now, I think I need to start further the IV fluid administration for this patient, right? But if you still want to read the case study, as I said, you can always read the case study after that too, to see if the answer is relevant or not. But first thing I'm showing you without reading the case study right now, right? So urine output definitely is one of my universal answer, which I think based upon that you will decide as a nurse, does your patient really need the IV fluids or not, right? So one fill up, I'll do it for you. And I already picked the urine output for you in here. So I'm just going to mark here urine output for you. So one answer already pick it up. Now, if you guys want to participate with me, ask yourself, right? Heart rate, right? Or look at the blood pressure of the client,
Ma'am,
right?
blood pressure is
Blood
mandatory
Blood
pressure,
because
pressure.
very good.
if
Because
we
the blood pressure is too low,
blood
right?
pressure is
Low blood
compensated,
pressure will
so
be
Very
it will
compulsory,
automatically.
right? Definitely your patient need the IV fluids here for sure. It's just 86 by 56 still right now, right? It's actually getting down now as compared to the 8 o'clock vital signs. Now you ask your brain another third choices, right? Do you think fever like is the 101, is that make you to feel to go for the IV fluids? Or the patient heart rate is getting now more techy. You can see now, before it was 120, now it's 124, right? Is that make you
Tachycardia.
more concerned now? Very good.
yeah.
Great,
Yes.
very good. Or do you think you look at the ECG, you're like QRS complex is wider right
No,
now?
ma'am,
Or
this
that
is
you
not
want to give
valid
the
here.
IV
No, ma'am.
fluids?
No, no.
No.
That there is no role, right, related to this one. That's not going to help you to fix your QRS complexes in there, right? So if you want to do this question without reading case study, as I said, there you go. Three answers you find out so far: heart rate, blood pressure, and the urine output. So you drag and drop in your real exam, you pick the choice and put it in there, pick the choice and put it in there with your cursor of the mouse, right? But if you still want to read the case study, this is how you can do that. Now, the students
Ma'am,
who are asking me the question on the YouTube, how do I add it to the live chat? Okay, so I'm actually on the WhatsApp right now. A lot of students are connected with me on the WhatsApp. So Zoom sessions, I always share the link in there. So next time, if anyone wants to participate in the Zoom session with me from the YouTube, you can definitely send us request on the number I'll give you at the very end of the slide, and I'll add you guys in there next time. So now I can see a question by Semi. Sorry, Semi, you have a question for me?
yeah, ma'am, as you earlier mentioned that the people checking the people is not mandatory. As much as I know regarding the NCLEX and the international, because I have worked at the hospital, Shifa International Hospital, Islamabad, and Khan University Hospital, and they follow the complete rule regulation of the CDC guidelines according to the CDC and according to international guideline. But
Okay.
earlier, whenever I go to the ICU, so we used to do assessment and reassessment. So
Okay.
in that, we must check. I used to check the pupils. So why no? This is mandatory to check. I know. I
So
personally
the
know that
question, the one
this
we
is
just
immediate.
discussed, yeah. So very good, very good. The follow-up question for sure, Sammy. So there is a difference between mandatory and there is a difference between life-threatening, right? So the one when I say the word immediate, something you want to think about the life-threatening could be related to ABC. Something which makes you think as a nurse, your patient can die if you don't look at the pupil right away, in there, right? Diet could be within any next few minutes, right? Mandatory means it's something important for sure, but it could
Mm-hmm.
be something non-urgent at the same time. But definitely it's mandatory during your shift to reassess and assess back again because it's abnormal again, right? Now imagine, let's say if I'm in front of you right now on the screen, right? So let's say if something happened for God's sake to my brain right now and I start maybe collapsing on my chair, right? So what is the immediate follow for you to do it? And if I give you two options, one is like level of consciousness. Definitely you want to check that quickly because something happening to me right now. The second
Yep.
option is for you is to basically check the complete set of vital signs, right? I think complete set of vital signs that can wait, even if it's
Yep.
urgent, that's required still, right? But that can wait because we already have something happening right now, life threatening, and I have to do quick action, quick assessment, something which makes the person life threatening in there right away if I don't go there. I hope it's making sense, the difference now.
Thank you
Like,
so
I.
much, ma'am. Now, my
Mhm.
you clear my concept
No,
crisply
I really want
clearly.
to make
Thank
sure you guys really understand
thank you
before
so
I
much.
always go to the next question, right? Because there is always no shortcuts, right? Now, again, everyone, I'm going to post these presentations always on the YouTube in the WhatsApp group. If in case I get delay in posting in there, please remind me, send me a message so I can give you these presentations. And you can always read these case studies back again as well and see if using case study, you want to find the answer somehow as well, right? But this is without reading case study. Another example I have on my screen is without wasting the time, the next question. And this next question, I noticed that without case study, 100% you can do it, right? Now, how 100% you can do it without reading the case study? Remember, on the left side of the screen, again, there is a case scenario in front of you, and the right side of the screen, there will be a question in front of you. Now, here, I already solved this question here in front of you. Why? Because I want to show you what type of question is this and how to find out the answer in the real exam. So this question I always call number 3 type of question today, highlight. So if you're getting any highlight type of questions in the real NCLEX or in your practicing during the practice time at home as well, remember for the highlight type of questions, you do not need to read the case study as per my experience, right? So this is how you should do this type of question. So basically just read the question first without reading the case study, because this is always exactly copy paste. If you notice, whatever they write down on the left side, it's every time similar thing or exactly same on the right side in the question itself, right? So basically here the questions they're going to ask you is the nurse is reviewing the maternal medical record prior to attending the birth. Okay. Now click to highlight below 3 findings. Remember everyone, if the question says 2 findings, you can only pick 2 findings. If it says 3, you can only pick 3. There is no choice to go to 2 or 1. Okay, you must have to pick up 3. Or if it says 4, you only have to pick up 4 first of all. Okay, so please always read the question carefully. If the question says 3, 3 means 3, right? That should concern the nurse. Again, did you notice the word concern? Something gonna make you feel concerned back here again now. Now, when I see this question, right? Remember, every time there is no highlight like this because you need to solve this question highlight like this in the real exam. And they always give you like the cursors, when you move your cursor around in every area, you will see some spots will get highlighted when you take the cursor next to them until unless you click on it, right? So every time they will show you more than the one you actually finding out in there. So for example, in this question, if we have to find 3 findings, the NCLEX will give me either 4, either 5 highlights into the total, right? Now, what do I mean with the highlights? Not actual highlight like this, but it's basically when you move the cursor in there, you will see it's something like a different color will pop up on the screen, right? Those students who are practicing right now using a software practice, you know what do I mean with that? But those students who are very new into this NCLEX journey, don't worry about it. You will learn more with the time with me. Okay. Now here, imagine nothing highlight right now so far. Imagine. And in this type of question, what you need to do is you always move your cursor and see where the actual color change in front of you. So actual color change will be in front of you in the real exam will be, the first option will be this: client diagnosed with the gestational diabetes and prescribed insulin, but she reports not taking the insulin. So this is a one complete sentence will get highlighted right away if you click on it. But if you do not click on it, they will only just change you the color, just show you the color changes somehow still there, right? Now, the second one, when you move your cursor in here, you will see the second one, the client reports cigarette smoking, but deny alcohol or the recreational drug use. So again, this is second color changes you will see in there. The third color changes you might gonna see in here in this line, and the fourth is this line, and the fifth maybe this line. So imagine these are the 5 in total, but you have to only find 3. So in that case, always ask yourself in the form of what? Prioritization, right? Like if you have 5 things in front of you, the 5 symptom or 5 sentences in front of you, who will be the most 3 priority in front of you? You think that will be very concerned and you don't want to miss that for sure, right? So imagine if I'm making notes right now back again. So if I go back to my previous slide, just to show you the idea back again as well. So imagine my first point, I'm writing down, the client diagnose, right, with gestational DM, like short notes you make on your whiteboard, and prescribed insulin, right? And but report not taking, right? So this is the first one in front of you. Now the second point, definitely you write it down wherever the color changes again comes in front of you. Report cigarette, right? Okay, report cigarette. Like every word, whichever you think it's changing color, you must need to write down to make some notes out of it, right? Now, report cigarette, but deny alcohol or any other. Deny alcohol, right? Yeah, let me see here. Yeah, alcohol, right? Okay. Now, the third one, imagine I write it down here is the treatment for bacterial vaginosis. So this is done already, right? Treatment for bacterial. This is like a past information they give it to you, right? Now, the fourth one, maybe in front of you here, I write it down here is the, it's a weight gain. You can see here some pounds, right? Weight gain. And the fifth point, again, I write it down in front of you, is the group B result is negative. So this is negative, nothing positive, right? So group B negative. As you can see, I only make very, very short notes, very, very short notes out of it. Something which only you can read it, you can only understand in your exam, right? Don't copy paste everything in there because you don't have enough time. Now, when I see 5 like those options in front of me where I took my cursor in the actual test and I see why the coloring changes in there. So 5, I just pull them down, right? Now, why did I pull them down? Because I'm going to ask my brain who is a more priority, 3 of them, right? So you pick that first, which is very, very concerned out of these 5s. So I would pick number 1 for sure, right? Because I think, oh my God, like if someone with the gestational diabetes and not taking insulin, I think I need to look into, right? So this is how you pick another 3. Now, what do you think, guys? If I give you another 4 options here, one is like reporting cigarette. This is past information already done. Weight gain is there and it's negative results. Another 2, which you think it's very concerned for you, you have to pick up them for sure. If you're not sure, use the elimination process. Anyone who wants to participate here? Okay, I'll do this one for you. If you're not quite sure, I'll delete the group B negative quickly because this is negative. This is not positive, right? And then I'll delete the past information for you because I think this is something can wait, past history can wait. And definitely when smart way you do the elimination process, I'm automatically left with the 3 different answers here. right? Weight gain, report cigarette, even though cigarette like reporting is not an emergency for you right now, but there is no choice, right? Someone mic is unmute right now. Please mute yourself, everyone, because I can hear some background noises as well. You only please unmute your mic when you want to talk, okay? So I can see it's only three options left in front of me, right? Now, those are the automatically the answers because NCLEX only give me five highlighted total options in front of me. And out of five, when I write them down on a piece of paper, I notice it's only three left, right? Doesn't make sense. And once you have in this way, you go back to your question after you make your notes, then you click on the actual line. And once you click on it, okay, somebody's mic is unmute.
शुक्र है अल्लाह का
Okay, Basit Ali, your mic is unmute. I'm making mute for you now, okay? Okay, only do unmute when you guys need to participate, okay? So here I can see once you go back to the question, then you just click on it, which you think it's the right answer. I click on the first one, I click on second one, I click on third one. That's it. And once you click on it, then the NCLEX will give you score. If any of them is wrong, definitely you're not getting score for that point, but whichever is you making right, you will get the score for that. Scoring criteria is a little bit different in each and every single question. So what I'll do is I'll bring a different paper for you or a different session for you for scoring criteria just to explain what type of question, how the scoring will be counted in there. Okay. But in today's class, we're just going to learn something basics, like what type of case studies question could be there and how we can do them, right? Now, I hope everyone is good with that type of question too. It's not very confusing, but feel free to stop me, participate if you have any question for me in there. Now, the next question I can see on my screen, which is related to the same case study, the one we previously got in here, even if you did not read about that, okay? Now, another thing I want to show you here in this question, and I think this question is my next fourth different type of question. If you want to write down and make your notes, this is we call indicated, not indicated type of notes. The question. Indicated, not indicated, right? Now, NCLEX will give you again like some case scenario on the left, and on the right side, they really wants to know what is indicated. Indicated means something you think as a nurse, this action required or could be a good idea to keep it in. You want to do that, right? Not indicated means something you feel like, not necessary, not required. I don't think so. It's relevant even as well, right? So that will be the not indicated meaning is. So now these are another very common questions in the NCLEX, right? Now, most of the time when I see the question indicated, not indicated, again, I can do this question most of the time without reading the case study, but I only go back to the case study with the information what I'm looking if I got stuck somewhere, right? So now let's try your best to participate with me after reading this question with me together. And we will only read the case study if we got stuck somewhere and something we needed, right? The nurse is preparing to obtain the newborn first capillary blood glucose level. Imagine you are the nurse here and you are obtaining this thing, right? For each nursing action, whatever you have in front of you, right? Click to specify. So you need to click here to specify if the action is indicated, you think it's required, or if the action is not indicated for the care of newborn during a heel stick time. Okay, so read the question carefully like this, the way I read it. Now let's go one by one and see what's the answer. I can see students from the YouTube, they're already participating in this question. Very good. But other students also unmute your mic also. Feel free to come forward and let's do this question together. Okay. So if I ask you the first point, warm the heel prior to initiating the procedure, is it a good idea? Is it a bad idea? You want to do it or you don't want to do it? Anyone?
Not indicated, ma'am.
Okay. Anybody else? You think in the form of general? Anybody else want to participate here? Or you guys scared now from the case studies question now? Question. Should I pick a volunteer here now from my side?
I would pick indicated.
Ma'am,
Very good.
indicated.
Yes, Brenda, you said you want to pick indicated, but why you want to pick indicated?
Well, it says warm. I don't think I would do like obviously a cold one, but it's there.
Very good, right? So if I see Sammy who says not indicated, if you're not agree with this, does that mean you just want to pick up the heel and you just want to start the procedure right away without even looking at the skin temperature, right? This is how the NCLEX will think, right? And they will be like, if you don't want to warm it, does that mean you want to make it cold? Opposite, right? Does that make sense, Sammy? Right? Or the other students who
Yep,
thought
ma'am,
the
got the
answer will be
point.
not indicated, right? I know this is new journey for you in the case studies. Just try your best, everyone, right? So yes, I'll say this is indicated. I'll keep it in. Collect the first drop of the blood for the blood glucose testing, right? First
No,
drop.
ma'am.
Do you think we get the first drop?
No.
No, ma'am, this is
First
not
we wipe it
indicated.
Now
off.
this one everybody knows not indicated. So you just click on the not indicated in the real exam. Draw the blood by pricking the skin with a small gauze needle. Do you think it's something required, indicated, or not indicated? You still have to pick one of these. In the real exam, you cannot skip any of these points. You must need to answer either one. Either pick indicated, either pick not indicated. Try your best, maybe guess answer.
Indicated, ma'am, because
Okay,
Ma'am,
anybody
indicated.
else?
we need
With
small
a
gauge
small
needle.
gauze needle.
Yes,
This is indicated.
maybe indicated. Yeah.
Maybe
Not
indicated?
maybe. This is indicated because we have to when we have to check the glucose level, we
Mhm.
might have to keep a small gauge needle with a gauze.
Okay, Brenda, what do you think on this? Draw the blood by pricking the skin with a small gauze needle.
I think it's indicated.
You think it's indicated too? Very good. Yeah, very good. I was just looking for more answers in here as well. I would also say this is indicated. Now let's go together for the next one. Obtain the blood specimen from the lateral aspect of heel. Good idea, bad idea. You want to say indicated or not indicated? If you're saying not,
Then it does
then let
not
me tell
make
you,
sense.
are you looking for different side or what?
Then this is not make sense.
Indicated.
Not indicated.
Okay, if you say not indicated, does that mean you wanna maybe draw the blood from the different side of the heel? Is that what you mean then? This is how the NCLEX will think.
Ma'am, is it contraindicated? I do not know about
No,
that.
this question is not the contraindicated related. Contraindicated means completely no, right? Not indicated means not required. It can be a good idea, but you don't require it here for this procedure at this time. For when you look at the question, it's related to the newborn and a heel stick, right? So I would say the
Yep,
answer.
ma'am. This is indicated. This is indicated.
Yeah, I would say the answer for this
Because
question, everyone, is the indicated. Yes, Sammy, you have the explanation for this one?
yeah, because the client is having
Yes, Sammy, I can barely hear you. Can you speak louder?
because the client heel stick. So why we should choose the specific arm? So we will might have to obtain the blood specimen from the lateral aspect of the heel.
Imagine,
This is the
guys, if you
rationale
have a
behind it.
newborn heel in front of you, I'm just making a temporary foot in front of me right now. If you're saying not the lateral, does that mean you want to poke anywhere in the front or any other side? This
No,
is how
ma'am.
you should think,
No.
right? I would
We
say
can
this
take
is
it from the
indicated.
lateral
Yeah,
aspect.
lateral aspect
Yes,
is
ma'am.
not a bad idea. It's a good idea if we
Yeah.
want to go with this, right? Think as a general always in front of a newborn. Like if you have a newborn in front of you, how you gonna hold the feet and how you gonna do the need like a stick, the poke in there and how you're gonna get the sample, right? Clean the heel with the alcohol pad prior to obtaining the blood specimen. Good idea, bad idea. You wanna do it, you don't wanna do it.
Good
Indicated.
idea,
Good
ma'am.
idea.
Very good. Good
A
idea.
good
Okay.
idea.
So my final
Good
answer
idea.
for
Why?
this
idea
question
in the
is
sense
warm, yes. Collect the first drop for this one is no,
Not
right?
indicated.
And then draw the blood, we said indicated, and then we said is the indicated, and this is also the indicated. This is how you do this type of question. Now, did you guys notice we did not even read the case study yet for this one? And they give you a bunch of information like 2 o'clock, 2:15, 2:30, so much information in there. So always see the type of question first and see if you really need to read the case study or not, because majority of the time you don't need it actually, right? You only need it, especially I would say, I'll bring the more question as I said in the future. The time is also running today, so maybe what I'll do one more question or two more questions for you today before we leave, but I have a more questions in the same presentation. So what I'll do is maybe I'll pick another session as well, most probably next weekend. And then if I can do before than that, maybe I'll try my best as well. But as I said, those type of questions are like bow tie question where you need to diagnose someone. Maybe you have to read into the case study to find what symptom is that, right? To find the actual diagnosis of the patient. So, yes, there are some case studies where you need to read the information and find the answers, but not all the case studies does require that, right? Now, this is the next question I have on my slide, right? And this question I called most concerning. Again, it's a single question, right? And again, I would say this question you can easily do without even reading the case study, but even if you still want to read the case study, yes, you can. Yes,
Tachycardia, ma'am.
Tachycardia, very
Weight
good.
loss,
There you go. Nobody gonna
diarrhea,
die with the
breakdance.
diarrhea. Nobody gonna die with the fine hand tremors. Nobody gonna die with the weight loss. But yeah, tachycardia, if I don't look at it, and it's already 160 right now, emergency could be happen. Very good. You already know the answer. I'll go to the next question quickly for you. Now, this is the type of question, another one in the NCLEX, where you have two different diseases in front of you, or maybe more than two, like 3 or 4 as well. That can also be there. It's definitely one of the harder type of question in the NCLEX if you're getting. Now, this type of question, I would say it's a mixture of knowledge, and it's also the mixture of, something you want to maybe apply, basically, especially what you learn. Definitely, you need to look at the case study if you need it, but at the same time, books knowledge required in this type of question. So for this type of question, I would just put the heading if you're writing your note right now. Disease process related question where they give you multiple findings and you need to find out the answer in there, right? So if you want to try this question together with me, those who do have a good knowledge of endocrine system, they can participate with me today. But those who are really like sometimes, I know the students, they're not good in the endocrine system. That's okay. My endocrine lectures are coming up soon in the future. At that time, you can do this question back again with me as well. Take a screenshot, save it somewhere, look at this question back again at that time. But these type of questions are very important. Frequently testing in the NCLEX, I would say. Now, I can already see the question is, they said for each finding below, so that means you have lots of findings in here. Click to specify if the finding is consistent with the disease process of hyperthyroidism or hypothyroidism. So one of each, right? Definitely the finding cannot, you're gonna find in both. It's a very rare case. It depends, but not in this condition, hyper and hypo. But if it's a different case, definitely coming in the future on the slide, then I'll show you sometimes one finding can also go into the both as well. For example, vomiting, nausea, maybe can apply in some conditions together, right? Headache maybe can apply in most of the cases too, but not in the hypo and hyperthyroidism I'm talking about right now. So here they say each finding may support more than one answer could be there, but not in hypo and hyper if you have a good knowledge about this, right? Now, if someone wants to read the case study, you can, but I can do this question without giving case study once you have a good knowledge about it. So ask yourself, hyperthyroidism, the weight gain. Weight gain, you want to put it in hypo or hyper?
Hypo.
Ma'am, hypo.
Hypo.
In hypothyroidism.
Hypo, very good.
Hypothyroidism leads
I
to
have
weight
a
gain.
hypertension.
Yes, everyone. Tachycardia, hypo or
Ma'am,
hyper?
Hyper.
Hyper, ma'am. Hyper.
Hyper, very good, because your hyper patient is running a lot, very high metabolism rate is in here,
Yes.
right? Constipation, you think it's more common
Hypo.
hypo, hyper?
Hypo.
Hypo, very good.
Hypo.
Exophthalmos, big eyes, bulging
Ma'am,
eyes.
hyper.
What do you mean
Hyper.
hyper?
Hyper.
Very good. And whoever is having the high metabolic rate, you know that they cannot tolerate the heat, right?
Yes,
They
ma'am,
love cold.
hypothyroidism.
So that will be hyper,
Hyper.
right? So see, if you have a little
Hyperthyroidism.
bit good knowledge, as I always says in my other video, endocrine is damn important. You cannot miss it, right? Because especially these topics are very frequently testing in the exam every day. So you really need to know them by heart, like hypo and hyper. But my endocrine system is coming very soon if you're very weak into that. The second thing is you only read the case study if you need it, if you got stuck, otherwise you don't need it. Now, moving on to the next question quickly, as I can see lots of students, they have a good knowledge. They know the answers about it as well. This is a similar way you want to think about this question. So I can see this question is in the form of anticipated, not anticipated. Again, everyone, this is nothing. This is just they wants to know which you think potentially a good idea prescription, required. I think this patient needed, so this is anticipated. You are assuming that as a nurse, okay, let's take that. Not anticipated, not required in there, right? This is how you think back again. So they already tell you in the question, your case study patient already get diagnosed with a primary hyperthyroidism. So for each potential prescription you have in front of you, click to specify whether the prescription is anticipated or not anticipated. And again, I think lots of nurses, many nurses, they know this. LOL medications are beta blockers, right?
Beta blockers.
So
Yeah.
you think
So-
it's anticipated if it's hyperthyroidism you have a client have, or the non-anticipated?
Anticipate.
Anticipated.
Anticipated.
Hyperthyroidism patient will
Very
might
good.
have the high hypertension.
Very good. The next medication you have is methimazole. If do not
Yes,
have any
ma'am.
idea what medication is that, hold
This is
on.
the group
I'll
of
show you how to do
metalazone.
this question at the very end, right? But if
This
anybody
is used
know
for
you want to give
kidneys.
it, yes, Sammy?
Yes,
This
ma'am.
is used for kidneys, and this is the group of metalazone, I think, as much as I know. So this is
Okay.
not anticipated.
Used for
Okay.
treating it is used for treating the thyroid hormone.
Very
So it
good.
is anticipated.
Very good. This is the actual rationale, the one who just said. Sorry, what is your name?
Mohammad Khuzair.
Mohammed. Okay, thanks, Mohammed, for participating also for this one. But yeah, I'll show you still, everyone, because I know some of my nurses, we are like, forget about the meds in the real test, how to do this type of question, right? I'll show you this technique at the very last. Okay, so hold on for now. I'll show you at the last. Perform the pregnancy test. Good idea, bad idea. You want to do it,
Good idea.
anticipated, not
Bad idea.
anticipated.
It does not make sense, ma'am.
Does not make any
Not
sense.
anticipated.
Okay. Now,
Yes,
when
ma'am,
you
not
feel like you don't want to be in rush, in this case, I'll tell you to go back to the case studies at that time. Okay. In the real case studies, they always tell you if your client is male or female and what is the age of the client. Maybe in my dummy, I don't have it right now today, but in the real, definitely you will get it. Okay. At that time, if you see like the age of the client in the form, like in the definitely the one she can ovulate, she can go and become pregnant as well, then you have to pick up the anticipated in there because she's gonna be on the lots of meds like beta blocker, methimazole, right? But if you think it's something, the age of the client, let's say 55, 60 plus already, and she's already menopause, something in the case study, they kind of give you a clue. Then at that time, you are like, okay, I don't need the pregnancy test for this one, right? Here I can only see the one I have in my dummy today is like reproductive, and it's the last menstrual period was like 3 months ago. So they did not really tell me exactly if she's already menopause or who, right? So I would just assume it like she missed the periods, but she is still something like in the form of reproductive that she can produce more babies, right? So I would do this test for sure for her because she's gonna be on 2 different meds in here, and everyone knows that in pregnancy we need to be very very careful which meds to give, which not to give it. It's a good idea. It's not a bad idea. This is how I would think it, right? Maintain the high calorie diet. Good idea,
Yes,
bad
because
idea?
because
Yes, ma'am.
calories are
Finger
more
food will also
calories
offer.
are more burning, and
Very,
weight loss is
Anticipated.
calorie diet.
Yes,
very
ma'am.
good. Definitely.
High
So
protein
now
and
it's a
high
good
calorie diet.
idea. Offering moisturizing eye drops. What do you think on this one? Do you think
Yes,
the patient require that? Yes, due to the
Yes,
hypothalamus.
disease
Everybody
Anticipated.
knows that.
expected.
Yes. So
Yes,
let's do this. Why not? Right. So once you know, this way, like then you can pick up your answer. But now back to those students who maybe do not remember what med is this one, right? So, well, simply, just see basically your most of the answers are on the anticipated side, what you're doing for someone, right? If you forget about the medication, what you want to give it in hyperthyroidism, chances is 70% this is the right answer, anticipated. 30% is a wrong answer because you mostly say, give it, do it, this medication, this is also good medication, this is also good procedure, just do it, right? Then you can pick up, like as I said, 70% as a good idea, anticipated, something you want to maybe expecting it, but you should still have a knowledge about this medication. Don't forget this medication because these topics are very important for the NCLEX exam, as I said, right? But this is how you can do the bouncer at the very end to increase your score in the real NCLEX, right? Now, another quick question related to this question I can see, and again, I can see this question is related to the same case study in front of you, and it's the appropriate, not appropriate. Appropriate, good, you want to do it. Not appropriate, bad, you don't want to do that, right? Now, read the question carefully. Only go to the case studies if you need it. If you don't need it, you don't need it, right? And I can see that it's already say here the client has been taking methimazole. See, now they already tell you the name of medication. So in the real NCLEX, you cannot go back to change your answer once you go next screen to look at the next question, just so you know. Okay, so you cannot change your answers there. The client has been taking methimazole for 1 month and now receiving the radioactive iodine therapy. And the nurse is reinforcing the client, teaching about the home precautions, about the first dosage of this one. Now, each nurse for each statement, whatever the statement in front of you, click to specify you think it's appropriate or not appropriate, right? So think in general back again with me, right? Now, the first one, if I use the word avoid sharing utensils with your
appropriate.
spouse. Good idea, bad idea,
Good
everyone?
idea.
Appropriate.
Appropriate, very
appropriate,
good.
ma'am.
Appropriate, ma'am.
It is safe to hold your child
Not
2 hours
appropriate.
after the
Not
treatment. Is it
appropriate
safe?
Good idea.
because they are
Appropriate, ma'am.
isolated for some time.
Very good, very good. Now, I think Sammy, you said appropriate. Do you think it's safe to hold a child after the radioactive iodine therapy?
No, ma'am. No.
This is
No,
how you
ma'am.
should
No.
think, right? So this is the not appropriate. It's a bad idea, right? Delay pregnancy attempts for the next 4 to 6 months. They are not making restriction on your patient. They're trying to teaching them for next some time. Try to make it delay pregnancy if you can, because she's already on the radioactive iodine therapy right now. So do you think it's a
Appropriate.
good idea or it's a bad idea?
It's not.
If you
It's
say not appropriate, remember it's
Not appropriate, ma'am.
that's not meaning is
Because we
not
cannot
required.
restrict our patient.
Appropriate.
Okay, remember guys, I'm saying back again, not appropriate meaning is bad. Not appropriate does not mean that non-required. Not required is different. The one we did the previous question. Not appropriate means bad. You think it's a bad idea. This is how.
appropriate.
It's appropriate.
Appropriate. I'm
It's
making it the
appropriate.
opposite side.
Yeah,
Okay.
yeah. So always remember, look
Appropriate,
at the
ma'am.
meanings first and then think about the answer, because there's a difference between anticipated, non-anticipated meanings, difference between appropriate, non-appropriate, because every language has its own meaning. And I know it sometimes sounds confusing as well when you see lots of questions together like this. I highly, highly recommend, like after you finish the session today, make some notes. This video will be available on the YouTube, everyone. make some notes, repeat the YouTube video wherever you need it, and just make a note. What is the actual meaning of appropriate, non-appropriate? What is the actual meaning of anticipated, non-anticipated? And what is the actual meaning of indicated, non-indicated? Because this sometimes sounds very familiar, right? And you are like mixing up your answer sometimes, right? So I highly recommend that. So delaying pregnancy attempt for the next 4 to 6 months, I would say it's a good idea. It's not a bad idea. So I can teach about this as a nurse to her. Wash your clothes separately from those of the others. Do you
Yes.
think it's a good idea,
Good
bad
idea,
idea?
ma'am.
Appropriate.
Good
Yes, ma'am.
idea.
It's a
Good
good
idea.
idea.
Appropriate.
Good
Very
idea.
good. You should sleep in a separate room for 1 to 2 weeks, right? It's like they're giving duration. They're not forcing the person a standard particular time that you
Good idea, ma'am.
have to go in there. Very good. Good idea. I'm not making a restriction again in this client as well. I'm just trying to teaching them between 1 to 2 weeks if you can sleep in a different room. It's a good idea. It's not a bad idea, right? So the final answers are already in front of you right now, and everybody can see here. So far, since we start this class today, I did not even read much case study so far yet, right? This is how you can handle these questions very carefully. Now, one question I can see left on this slide. Maybe let's do this question as well before we leave today. Now, this question I call bow tie question, from which one I think many nurses, they get scared. I will bring more bow tie questions in the future, because in today's it's just like I need to show you different type of questions too. Now, bow tie question meaning is what? Bow tie means you actually need to diagnose here to this patient. Okay. Now, for this patient, highly, highly recommended. Yes, you need to read the case study, complete case study. You need to read it. And then the second thing is I want to say is when you're reading this case study, try your best to read the options first and then read the case study after. This is what I recommended everyone. Okay. So what are we supposed to do in here? It's nothing. They just give you like a diagram in front of you. And by dragging some options from below, you need to fix your answer in these options in front of you. So you have like a middle part. You can see condition most likely experiencing. This is where you're going to put your potential condition, the one you think it could be the diagnosis for this patient after reading the case study. So if you read them before, like COPD, myocardial infarction, pneumothorax, that will give you an idea what exactly are you looking here, right? And then after that, do not read the actions or parameters at very first, because I can say 100% you will forget about it by the time you read the case study, right? So only read the potential condition first and read the case study next, find the diagnose first, and after finding the diagnose, then we will think about two different actions which we need to take and two different statements of the patient, which indicating correct understanding here by the patient as well, right? So you only do these side parts later on, everyone. Don't do everything together. Only do the diagnose first is in this case. Okay. So let's see this question together with me quickly before we leave today. And you also try your best to find out the diagnose with me here. Now, once I know this is something respiratory, cardio, respiratory,
This is
now I know what to
respiratory.
look in there, right? So the client report progressively worsening shortness of breath for 2 days. Again, you really need to make a short notes. Okay. How many short notes? Minimum 2 points, maximum 5 points from the whole case study, right? Don't put too much into there on the whiteboard, the one they give it to you. Only read, write down whatever is the relevant information you think about it. Now, this is progressively worsening already, right? Shortness of breath. So I will highlight this one on my notes at the side. He reports having the low-grade fever, runny nose, increasingly productive cough, and it's already 1 week productive cough is there, right? Again, this information, why I will put it yes on my board, because this is something present situation right now. And I need to diagnose this person according to this, right? They give you kind of like a symptoms here. Smoking history, well, I will only come to this if I need it to look as a risk factor or whatever, but keep it on the side for now. You only come back to this if you need it. Now, the client use accessory muscles for breathing. Again, this is something I can see the present, but can speak still. Good. Can speak in full sentences. Good. But still using accessory muscles sounds like a breathing issue, right? Now, when I say breathing issue, I quickly jump to my vital signs. I'm like, okay, what is the oxygen set look like? Oh, 91% on the room air, right? This is how you correlate and think 360-degree. Now, the chest rises and falls symmetrically, right? Decrease breath sounds and bilateral wheezing during the auscultation, right? You only write down the information what you needed, okay? Chest is round, anterior posterior diameter is increased, right? And then clubbing on the fingertips also there, right? This is how you read the case study. And if you see, we have like 7, 8 points in here, but try your best from 7 to 8 points, write down which is the top most 3, 4 important for you. That's it, right? For example, maybe I will write down like shortness of breath. And this one, I'm not gonna write it down because he not gonna die with a fever or the runny nose right now. But maybe I will just write down along with the shortness of breath here in my first point, accessory muscles for breathing, right? And then
Pneumothorax, ma'am.
yes, sorry.
Pneumothorax.
Okay, we'll discuss the answer very soon. And then after that, I will write down the second point is chest rises. And then maybe third point, decrease breath sounds, right? I'm not concerned about the clubbing right now, right? Oh, little bit tachycardia is there. Maybe I'll write down this one too, right? And then in the chest x-ray, they give you bilateral hyperflation of the lungs and the flattening of the diagram, right? So this is how I would just read it quickly, but I don't need to write down this information on the paper. I will only come back to this results if I need it to find someone, right? Now, when you see the option, right? Lots of time the nurses do not know the diagnosis of the client. Okay, try your best to find out if you can, it's good, but if you cannot, this is the trick. Okay, now what I do in that case is only if you got stuck and you don't know what is the diagnosis look like, then I try to find out the one answer only out of these two first and then link with my potential condition in that case. For example, let's say this is like nitroglycerin. I would be like, there is no chest pain, right? I don't really see any chest pain right now that I have to give the nitro or something for that, right? What everybody think on it? I don't think so. I need that, right? Now, when I delete the nitro right away with the confidence, I would be like, okay, sputum sample, yeah, because it's productive cough already 1 week. And they're giving like the short, this one inhaler. Sorry, I'm just gonna put my screen on the side of the Zoom meeting. Just a second so I can read it carefully. Okay, it says request a prescription for inhaler. Inhale short acting beta adrenergic agonist, like a name of the medication inhaler they give you. Lots of students, if you do not remember what they do it, you know this is respiratory medication for sure, right? And you're doing inhaler as well, right? So this is nothing a bad idea if you already eliminate one answer. So two answers will go into here for sure. And you only do this trick if you cannot find the diagnosis in the first go. If you can find the diagnosis good, then you read the actions later on. But if you cannot find the diagnosis at all, let's say those students, then you only play smartly with the side options first. Right now, when I already pick my two answers here, one is collecting sputum, and the second, I'm going to give a prescription of the medication here, right? So ask yourself, you're doing collecting sputum inhaler. Do you think for MI patient? What do everybody think on this?
No, ma'am.
Sputum sample and that one? No, right?
No,
Now
no.
you will be stuck between two different diagnoses. One is a COPD, right? And the second is a pneumothorax, right? Now you ask yourself, who has the
COPD.
problem of shortness of breath? Very good, right? Who has
COPD.
more these type of assessments is in there? You ask yourself,
COPD.
if anybody don't know what is pneumothorax, you at least know one word, air something in the lungs is in there. You ask yourself, like, is this something more? Because COPD, let's say you don't have a much knowledge, you only have one word, maybe knowledge. Okay, shortness of breath, they always feel all the time. Then you ask yourself, where is it more closer, like COPD or the pneumothorax? I can hear some
COPD,
COPD
ma'am,
for sure.
100%.
Very good. The
Because he's
one
on
which is
inhaler.
not pneumothorax, what do you think? Why not the pneumothorax, everyone?
Ma'am, if it was pneumothorax, so the patient would might have not a saturation of 91%. The second thing, he was not on a inhaler, and he would not on a. It would have loads of, and this patient would might not have wheezes.
Very good. One thing I want to highlight it, the difference between major here in this case study between COPD and pneumothorax is, remember in pneumothorax, basically the diminished breath sounds and also the chest wall expansion, it's unilaterally, not the bilaterally, right?
Yes.
So if you have that much idea, then you can go from there as well. Another way how to find out this one is the right answer. So I hope everyone is learning with me. How did I try to correlate something COPD with the actions is in here? And then you put
Yes,
the
ma'am.
COPD here. Now, once you know COPD, do you think you need the troponin levels for
No.
No, ma'am.
COPD patient? No. You
Never.
already know your answer. Change in the level of consciousness. Okay, your patient basically says something that indicate the correct understanding.
Ma'am, yeah.
And your patient talks about the forced expiratory volume. Okay, that is the another right answer is in here. So this is how smartly you can play with the options and find out the final answers as well. Now I can see some questions are here for me. Yes, let's go please one by one. Anyone has a question still for me in here?
No, ma'am.
No? Is everyone learning today?
Yes.
Yes, ma'am.
Yes.
Ma'am, loads.
Okay, perfect. I think we finished for today for the case studies. Again, these are the few case study sample which I thought to bring it in front of you. Now, the learning from this session overall is every case study has its own strategy. So I really recommend to write down if the question asked this way, do you really need to read the case study or not, or you just jump to the question, right? So try your best to apply these strategies, everyone, because for me, they work every time 100%. And I really want to give you these to you because I'm very confident they can work on you as well because they've already been tested before in my other students before as well. And it just, believe me, changed the way of your thinking, how to look into the question, how to read the case study. Do you really need to read the case study for sometimes or not? And definitely believe me, once
Yeah,
you
ma'am, just
apply
I
these
have answered.
strategies, they actually going to help you a lot in solving your lots of answers as well. Now, if anyone has any doubt for me, any question for me before we leave today?
Ma'am, lots of respect and thank you so much.
No worries, Sammy. I hope everyone liked the class today.
Yes, ma'am.
All
Yes,
good?
thank you so
Yes,
much.
Okay,
ma'am.
perfect.
Thank you so much, ma'am.
No worries. I'll come back again, hopefully next weekend with the next session. But I'll post about all the informations on all the social media. So keep checking that. And the last thing I want to say, as this is like a Diwali time, so happy Diwali, everyone. I
Same
will
to you,
be off
ma'am.
today
Thank
and
you.
tomorrow, but I will try my best after tomorrow to address your all the question and queries which I can. Okay. Thank you so much for joining the lecture today and
Okay,
enjoy the
ma'am.
Diwali time and enjoy the vacation at the same time. Thank you so much.
Thank you. Have a good day.
Thank you.
Lots of
Bye-bye.
respect. Thank you.